Hi, my name is Eddie Santos. I'm a retired Army sergeant with more than 23 years, and I am a disabled vet. I've been all over the place trying to get assistance for my disability. And as for right now, the only person that seemed to help me out was when I went to the congressman's office, tried to get some assistance for him to help me get my prosthetic leg fixed. So finally the congressman had me the opportunity to go to Palo Alto in San Jose, California, where they finally fixed my prosthetic. If you need help and you seem to not get it anywhere, you should go see our congressman with the people he has there to help us veterans get what we need and what we deserve for doing our time in service for the freedom of our island and for our country.
This ad was paid for with official funds from the office of Congressman Michael F.Q. San Nicolas.
Funerals actually take a lot more planning than I expected. With us using island cuisine for the first time, of course we were iffy, but once they came and showed us their service, their food, tasted their food and everything, we definitely use them again because their service and food is just awesome.
I'm gonna connect you with Crystal Paco.
Okay.
Okay.
Thanks.
Hi, Troy.
Hi, Crystal. Hi.
So our public health rec is in a meeting right now,
Okay.
but I would encourage you, based on the question you had, I would encourage you to speak to one of our public health nurses. These are our nurses, again, they're a little bit older, so they shouldn't be on the field anyway because, again, they're just part of the susceptible group. The numbers are 480-7059, 480-7067.
I'm sorry. Can you repeat those numbers?
Put the rules in
480.
480-7859,
Okay.
480-6760, that's 60,
Okay.
or 6763,
Okay.
or 480-7883. And so here you can talk to a public health nurse. Again, please limit your calls or your questions to medical related inquiries only. It sounded like you were dealing with someone.
Well, this is not a medical question. This is a policy question.
Okay, what is the question? Maybe I missed it.
This is a policy question on the testing guidelines. If let's say I have symptoms of COVID-19 and I have a fever of 101 degrees, let's say, but I have not traveled and I'm not hospitalized. I go to my doctor. Let's say my doctor is Dr. Akimoto. And I say, Dr. Akimoto, I have symptoms, I have a fever, I have not traveled, can you test me? His next question to me is supposed to be, according to your guidelines, have you been in contact with a confirmed COVID-19 patient? My question to you, Crystal, is how am I supposed to know of all the people I've come in contact with in the last 14 days, who among them are confirmed COVID-19 patients?
Okay, Troy, so this is by the doctors, the advisory council that came up with the physician's alert you're referring to. They created that category. It's called a surveillance case. So it's someone that doesn't quite meet the PUI criteria, but we still warrant a test.
Yeah, so the thing is that a whole bunch of people who fall under this category are being denied testing.
Did they give a reason why? Or was given a reason why?
Public health said so. They're not giving the doctors a reason.
Well, I know that we're building our capacity for testing, and Linda DeNorse recently signed a contract with DLS so we could send our tests to Hawaii and California. This would be our surveillance cases that we'd be testing.
Wait a minute. I thought you said yesterday that we have adequate testing capacity. You said
we do have adequate testing capacity, but as of late yesterday afternoon, I was briefed, and she informed us that she also is building our capacity so that we can test more.
To go off island.
So
to go off island, yes, Johnny.
Okay, so is the reason that some people might be turned away for testing because our capacity has been limited?
question? I'm sorry, the phone was ringing.
Is the reason that some people have been turned away for testing, is the reason that our capacity has been limited up to this point?
Sure, that's safe to say. Again, we want to prioritize those with symptoms.
Okay. Thank you for being honest about that. Thank you. So, when will this capacity be increased so that those people who, I guess, fall in this new surveillance category can get tested? Because there are a bunch of people who are concerned who went to a rugby game, a Republican Party of Guam event over the last weekend. They're a big concern that they've been exposed.
And that's why we keep emphasizing the social distancing mandate, and that's why yesterday the governor signed Executive Order 2020-05 for social distancing guidance.
Okay, but what I'm saying is, how can these people who are already sick get treated for COVID-19 if they're not getting tested to determine that they have COVID-19?
So our healthcare providers, we trust their judgment. We consult with our epidemiologists. We have our CDC epidemiologist as well. They're consulted and vetted whether or not we should do the test. So that's the protocol.
When you say healthcare providers, are you talking about the individual doctors? Because there are doctors who are saying that the decision has not been made by them, it's being made by public health, and it's been out of their hands.
Okay, so what I understand is the doctor will call our epidemiologist to present the symptoms or explain the symptoms, and then it's decided from there whether or not this person could have another respiratory disorder.
Yeah,
or can just stay home and be treated.
If my
But
doctor,
how can-
wait, if my doctor is saying, okay, you need to get tested, it's my doctor's decision to test me. Why do I need to call public health, who is not there in the clinic with me? That's my right as a patient. If my doctor says you need to be tested, then you test me. I don't want public health doing it.
So, Crystal, what you're saying is that the decisions are coming from Dr. Ann Klubutsky, the state epidemiologist.
Who couldn't even get the dengue right.
Crystal?
Sorry, there's a lot of people in the room, and all I hear is yelling on the phone.
Yeah. Well, maybe if you
Well, I'll
just
get you more
answer.
answers. I'll follow up on everything.
Well, Crystal, you told us you were going to get us answers yesterday to a whole bunch of questions
And
that we
I am
asked.
it's going to be in the next release once I get everything verified and vetted.
Are there any, have new tests been conducted today?
Yes, and I'm waiting for his results.
So you don't have the
And
results yet?
I'll have some profiles available.
Oh, so we'll have patient profiles of the confirmed cases already?
I will have some of them.
Some of them.
At least as many as I can get. And that's information the public deserves to know. I agree.
Okay, so onto the issue of the message to travelers in Korea that I understand you guys have taken down. I also understand from your interview with Sabrina and Chris earlier today that you, the governor's office or GVB, had taken down similar videos from our source markets. So are you confirming that it wasn't just the Korean market, but it was also the Japan, Taiwan, Hong Kong, and Philippine markets that those videos were being played in?
After my interview this morning, I did follow up with GVB, and they said that it was translated in different languages and posted, yes.
Can you
but
tell
it's
us?
since been removed.
Can you tell us what markets those are?
I'd have to follow up with Josh, but I definitely know that it was at least Korean and Japanese. That's the ones I'm aware of.
At least Korean and Japanese. Okay. And they were all up and running until this morning, I assume?
I guess. Once I was aware of it, I made the directive to remove it.
Thank you for that. Did the governor not think that it was maybe not a wise idea to be inviting people from coronavirus affected jurisdictions into our island in the months of February and March?
Well, back then, Guam was still unaffected by coronavirus.
No, but I'm talking about the fact that these places, Japan, Korea, and the Philippines, were affected by coronavirus.
We've had screening measures in place.
No, they didn't.
But well, actually, no, those
They didn't.
those measures weren't in place until about a week and a half ago.
Can we just get a comment from the governor?
Sorry,
Ask her for a comment.
Those measures were not in place. You're talking about the screening at the airport. Those measures were not in place until a week and a half ago.
So our pandemic plan has been in effect for quite some time now.
No, but
And that's what we
what
published
screening are you
before.
talking about?
I'm sorry?
What screening are you talking about? That
So
screening was
the
happening.
protocol, the pandemic plan protocol, the communicable disease protocol. So before deplaning, if someone is sick,
Okay.
Customs is notified, and they're aware of who is sick, and we vet them there.
Crystal,
I'm
is
sorry, I
the
really
governor
gotta go.
is the governor
I really need to go to my
contemplating is the
screen so I can get the
governor
results.
is the governor contemplating an apology to the people of Guam for any decisions she may have made that may have not been good for this COVID-19 response?
Not that I'm tracking.
Thank you,
Troy, I
Crystal.
really gotta go to my next brief so I can get you some results.
Thank you very much.
Thank you, Troy.
Bye.
Thanks, Josh.
Hi, my name is Eddie Santos. I'm a retired Army Sergeant with more than 23 years, and I am a disabled vet. I've been all over the place trying to get assistance for my disability. And as for right now, the only person that seemed to help me out was when I went to the congressman's office, tried to get some assistance for him to help me get my prosthetic leg fixed. So finally the congressman had me the opportunity to go to Palo Alto in San Jose, California, where they finally fixed my prosthetic. If you need help and you seem to not get it anywhere, you should go see our congressman with the people he has there to help us veterans get what we need and what we deserve for doing our time in service for the freedom of our island and for our country.
This ad was paid for with official funds from the office of Congressman Michael F.Q. San Nicolas.